All right, so hi everyone, welcome to the channel. Thank you so much for tuning in. If you're here on TikTok, big up yourself, and on YouTube at ThinkNursing, big up yourself too. But today we're going to talk about some of the red flags that definitely needs to make mention of whenever you're doing your patient handoff. The first thing I want to talk about is the abnormal vital signs, because I know a lot of times the vital signs are abnormal, but sometimes we fail to not make mention of it. But it is very, very important when we're doing our patient handoff to go ahead and do the vital signs. Talk about your blood pressure, the heart rate, the oxygen level, if they are abnormal, and what you've done. It doesn't make sense to have a patient that is having abnormal oxygen saturation. The saturation is 88% and the patient is not a COPD and the patient is there, not on any oxygen. So just go ahead and if you realize that there is an abnormal vital signs, go ahead and address it. If it means that you're waiting on an order from a doctor regarding something, go ahead and address it, and then you let the nurse at handoff know what you've done at that time, so they can always go ahead and evaluate the patient to see if it is improving. Another thing you definitely want to talk about is if there is any unresolved pain. A lot of times we might be giving patients medications and the patient is not having any improvement in their pain level. So you can always go ahead and let the nurse know what medications you've given for pain and how the patient is responding, so we can at least know what we're dealing with. Another thing you definitely want to talk about is if the patient is at risk for fall. Sometimes we have some patients, and based on the bed or the stretcher that they're on, it is going to be a fall risk. So you definitely want to alert your nurse as to the elderly patients that are at risk for fall, or the confused patient that is at risk for fall, so that way they can put up the necessary things in place, whether or not they need to get a sitter, whether or not they need to get socks, get them closer to the nurse's station, whatever it is, then definitely they will be able to address that. Another thing you want to look at is persons who have pressure injuries, or you notice that there is a risk for, go ahead and let your nurse know. So in the event that the patient is in the department for too long, we can always go ahead and do rotation, those frequent turning on the patient. So definitely go ahead and make mention of that. Another thing you want to talk about is your critical results. A lot of times we're doing handoff and we might not make mention of the critical results, but definitely always talk about your critical results, because depending on what level is abnormal, so for example potassium is abnormal, definitely you'll know that you need to keep the patient on the cardiac monitor and be looking out for your arrhythmias. If the patient troponin is abnormal, definitely you're going to be doing serial troponin levels for that patient. So if it means that you're going to be doing your troponin 3 hours, 6 hours, depending on how or the orders that you have working with, then definitely you'll be able to get those going. But definitely let your nurses know about the abnormal critical results that are available, so they can have in their mind that this patient can go to a CT scan and get a CTA because their creatinine level is elevated. So another thing you definitely want to make mention of is the fact that you have new orders or orders are pending. Definitely let your nurses know about any new orders. Sometimes you might get a phone call and you don't remember to put in the order. Sometimes when you're doing the handoff, it is at that time you might be able to remember it. Definitely go ahead and put in your order and let the nurse continue with the care of the patient on those orders. Or you might have a patient that has orders for CT scan, but you're waiting on a creatinine level. Always go ahead and just let the nurse know, so they can always call the lab or whoever to find out what's the status on the creatinine level, or what's the status on you coming to pick up the patient for a CT. Another thing you definitely want to address is the mental status. Always go ahead and give what the patient mental status currently is, and what at the time of presentation their mental status was looking like. So if there is any change or abnormal in their mental status, it is very important that you go ahead and let the nurse know. Also go ahead and let your provider, your doctors know as well, so that way in the event that they want to do any form of CT scan or anything else, definitely they will be able to do it based on the observation of the patient. But there are so many other things that you can definitely report at the time of patient handoff that are very important, but I know that these are very, very important things I would say you need to go ahead and hand off. Even if you're not doing the other things, definitely make mention of these. At least your nurse will be able to say, okay, then in the event that she has 4 patients, if you are able to give her all of these information on each patient, she'll be able to say, okay, then my most important patient at this time is this one, without even having to go through the entire chart itself at the time of handoff, because in her mind she has an idea of what needs to be done now or who is waiting on what, so she has a basic idea of what's happening. So it kind of helps with the nurse as well when it comes on to prioritization as well as the flow of how her day will go. So it's always good to kind of just get some of these information ready to hand off to your nurse at the time of handoff. There's so many other things that you can definitely, you know, as I say, hand off, but always try to keep it a little bit more concise, because you don't know, you know, some nurses don't really want to, you know, the talking, the long talking, you understand? They just want to get to the point. So always just get the most important thing and just hand off. If there's anything else that you definitely have in mind, let the nurse go ahead and ask. Or if it is something that you definitely need to hand off, make mention of it at that time. All right, but I do hope that these tips were beneficial to you. If you do like them, go ahead, give the video a thumbs up, add it to your favorite, repost it, so that way other persons can be aware of things that definitely they need to do at the time of shift handoff. And remember to leave a comment as well. Until then, thank you so much for watching, and I will see you in the next video. All right, and big up yourself. Later.